Spinal Synovial Cysts. Introduction. Please point to the facet joint. Choose one of the following options. Correct. This is a facet joint. Synovial cysts in the spine are fluid-filled sacs that start in the facet joints. Select true or false. Correct. Spinal synovial cysts can form when the facet joints are damaged. Select true or false. Correct. The synovium produces more synovial fluid to protect the facet joints when they are damaged. Sometimes a synovial cyst can form if some of the extra fluid escapes the joint capsule, creating a sac-like bulge. All spinal synovial cysts cause pain, numbness, and weakness in the back. Select true or false. Correct. Only spinal synovial cysts that are large enough to press on nerves or other structures in the spine cause symptoms. All spinal synovial cysts require treatment with injections or surgery. Select true or false. Correct. Cysts that do not interfere with daily activities or cause symptoms may not require treatment. In these cases, regular imaging tests may be done to see if the cyst changes over time. Which of the following are treatment options for spinal synovial cysts? Choose one of the following options. 1. Injections. 2. Surgery. 3. All of the above. Correct.
Thank you for using Explain.